Kate Stone's one of our Soft FM service managers who's come to support us with our presentation. And what we want to do today is talk to you about how us working together and the different teams working together supports this process and getting new innovations in place and improving the safety for our patients of our hospital environment. Because it is really key, I think, to work together. If we didn't do that, I don't think we'd be where we are today. So the first bit is just kind of a little introduction into what we do together as a team. So, as we've said, Trust Estates and Facilities, Soft FM providers and the infection control team, we meet on a really regular basis, at least monthly, but probably more often with the different meetings we have. We look at different processes, so we currently have a bespoke decant team for when we had a decant ward, which, as you can all imagine, we don't have that at the moment. We've been unable to maintain an empty ward so we can decant, but we've come up with a new process. So, we've said, you give us one bed and we will deep clean. We will come up with a process to do that, and our teams have supported that. So we still have the team dedicated to do those decants and deep cleans, and we just do it in a new way. We've worked out how it's going to work best, what we're going to do, how can we still do this, because we've noted when we don't do the decants and the cleans in a deeper level, our infection rates go up. Most oftenly C. diff is we tend to see. So it's really important that we try and maintain it as much as possible. We also have a periodic clean programme. So we've got a team that go around and clean the floors on a deeper level and other areas, and that's on a programme that we all discuss and plan together. We have our daily planned tasks as normal as everywhere else does, and we also have reactive teams that can anything we ask for. And I will be honest, IPC tend to ask for a lot when it comes to cleaning. We're known for that, and we want it now a lot of the time. But we know each other, we work really well together, and our teams can normally react to us within 20 minutes. If we've asked for an enhanced clean somewhere, they will go and provide that for us. And I think that's really important for us and our patients. We are in a really good position and really lucky with the support we get from our providers. From my perspective, we look at any new guidance that comes in, we implement it, we put plans in. The national cleaning standards, we spent hours going over those plans, making sure we've got the right FR ratings in all the areas. And again, it was a joint decision. It wasn't this is what we want to do as a trust. It was how can we work together? What compromises do we need to make? What's going to work for our patients the best? We do the joint audits, and that's hard FM, soft FM. We can have health and safety if we need it on there. We can bring fire and security in if we need it. We bring the waste teams in. So we all go round and we look at everything. So we don't just look at our cleaning and our IPC practices, we look at our estate as well. We look at what's going on. Do we need to change our estate? Is there maintenance that we need to do that's missing? So we pull it all together as part of those joint audits. The efficacy audits for the national cleaning standards. My team's diary is quite full from an audit perspective. We probably do 3 or 4 different areas a week on those, and it is time consuming. It does take a lot of labour to do that, but it's really important for us as an organisation that we keep that up and we know that we're being proactive. We don't just want to react to those situations and problems. We want to find them before they get too big. So we also look at the new innovations, which Louisa and Kate are going to talk to you a little bit more about. So looking at piloting any new innovations, and the team will bring them to us, or we'll bring those to the team and say, this has come out, we've seen this, we'd really like to have a look at it. Can you support with this? And we put a plan in. How can we do it? Can we pilot it? Do we need to just bring it in? What kinds of things do we need to do to make this go? And we're all quite willing to look at anything new anyway. I always think it's good to get in there first. If you can, have a look and have a play with the equipment, make sure it works for your environment, because we all have very different environments as well. So our hospital, we have 3 different hospital sites. One is a brand new build, say brand new, it's 15 years old now, which is great. One is a partial brand new build with some renovations, and one is probably 100 years old. Yeah. Newark? Yeah. So we've got the wide range of sites available to us to be able to. So when we look at one innovation, we've got to make sure it's going to work across all 3 sites and in all those different environments as well, which is key for us, because we don't want to be doing different things on different sites. It needs to work, because all our teams work across the sites, so we don't want them to have to do too many different processes. So I'm going to pass you on to Kate and Louisa to talk to you about how we implemented the robotic innovations.
Do you want me to go first? Yeah. Okay. Hi everyone. So obviously at Sherwood Forest Hospitals during the COVID, we piloted Ella, the robot. Was very, very welcoming to the trust for the people who were able to actually come on site. Ella is really, really good, and obviously she supports the cleaning requirements across the trust. So what she's doing is cleaning the floors and obviously enabling staff to then go around and do the higher services and do the intricate detail services in the corners where the robot can't reach. And obviously she meets the cleaning standards and has been a contributing factor to keeping our corridors and areas clean and safe. She delivers improvements in productivity to obviously for the whole cleaning corridors and open spaces. And she's quite sustainability as well, because she uses a lot less water compared to the traditional scrubbers and dryers. I'm reading off there because even though I've got my glasses on, I can't see here, so I'm having to read off there a little bit. My age. So yeah, she's really, really good. We have had other case studies, part of the PLACE, patient-led assessment to the care environment, some of you guys will know that. I'm the PLACE lead for Sherwood Forest Hospitals. So as part of the governing bodies and the patient representatives coming on site, it's been a great welcome, because obviously the robot does interact with patients. The feedback we've received is obviously, because if someone stands in front of Ella, she will talk to you, she'll cry at you, she'll tell you to get out of the way, and she'll sing you a lullaby if you want as well. Yeah, she tells jokes. So she's really interactive, and the kids absolutely love her as well. So as part of that, not just does she do a great job on cleaning the floors, but she's also an integral part, and we call her part of the team now. So she's really good with what she does.
Staff go hunting for her. Staff go and look for her.
Yeah. Go on corridors.
You know, when they're on the corridors, if they know Ella's out, they'll go and have a look because they want to meet her.
Yeah.
She does improve morale.
She does.
Famous.
She's very famous. We do have 2 robots on site, Ella and I think it was Hansel. Yeah,
but
he's gone now to a better place. But yeah, we still have Ella. But yes, obviously we still have Ella, who is very, very good. Highly recommend one of the floor cleaning robots, definitely. So next.
I think one of the things for me from this, as Lou's mentioned, is around was never an intention to reduce staffing in any way, shape or form. This was to maximise what the teams can do. So it enabled, especially during COVID, for the team to go out and clean the high touch surfaces more frequently, and it freed people up to do those jobs whilst they were still on the corridor with Ella. They were still doing other work as well, and it just enabled us to increase that frequency of high touch cleaning. And those areas, as Lou said, in the corner of the corridors, because that's something we'd frequently pick up on audits, that you'd still got grit and things in the corners where it was really difficult to get in, and when the teams were scrubbing the floors, they were doing a great job, but obviously it does take a lot of time, and this enables them to concentrate on those areas that we know are problem areas and give us that reduction there, and I do think that played a big part in helping to keep our outbreaks low, especially during COVID.
So just going to bring you over now, Kate.
So we just want to talk about how the robot fits in with the new cleaning standards. So due to the new cleaning standards, it meant that touch points get cleaned often, your bathrooms and public toilets. So with the robots on the corridor cleaning the floor, it meant that the domestic could concentrate on the outer toilet cleans and the door handles and the door frames. So it was quite efficient in what it actually does. The cleanliness achieved lasts a lot longer. So the quality of the floor, the surfaces, it sort of like sealed them. So it had a shine on constant, what people did pick up on quite often. Fewer chemicals. In the robot, we don't have any chemicals at all. So it was just watering pads and it worked absolutely fantastic. We've had plenty of positive comments. Like I've said before, it frees up cleaning staff to focus. So in COVID, they could do door handles, they could do toilet flushes, and it helped. Is it C. diff? It helped cut down on C. diff cases. And it was just a friendly presence. The children especially, the children had come up to it and it'd tell it a joke, it would sing a song. And if children are in hospital, they're quite scared, so seeing a robot helped in quite a few ways, didn't it?
Absolutely.
Yeah. Do you want to talk about place? Place visit? Yeah.
I was just going to drop in about the floors. So
yeah.
I know that the team and I know that one of our colleagues had a real concentration on floors and floors not looking clean, having that dull, not shine, but you want, because we can't have a shine, but having a luster, to them, and it was a real big thing. And you know, there was a lot of calls to our help desk to say somebody needs to go out and look at these floors and things, and they definitely reduced when we started to implement the robot, and you could see that you know, that luster was coming back on those floors. You know, so I think that was kind of key for us as well, to see that we weren't getting that frequent. Every time, you know, we were in a meeting and it's the floors aren't great, and we were just constantly getting comments with regards to it, and I think that has massively improved.
Loads. I haven't had a complaint
well.
in ages since, so that's touch wood.
It is.
Definitely.
But yeah, and obviously just going back to the place, like Sally said, you do pick up when you're walking around doing inspections of the cleanliness of the floor and the surrounding areas, and we got some of the feedback that was the floors look absolutely marvellous. Everywhere they go, they look as though they're new. There's not, like Sally said, there's not the shine, because you can't have a shine, but there's a sheen, a lower level, and you know, what's been implemented from that, and obviously the cleaning standards, we're well up there. And you may not be able to see the scores, but the place scores for our cleanliness is 99.85% across all 3 sites, so which is a testimony to our domestic services and obviously our innovations with the robots in achieving this. Obviously,
I was just going to say, our patient reps who come and do the place audits, they look at everything. They are quite harsh on us. They will find, that's sort of the 9.8, because they will find, if there's something there, they'll find it, and they do tell us, because it's their hospital. They're coming, they want their hospital to be the best. That's where they're going to be treated. So, and we encourage that. We really do encourage that, because there's no point in us hiding behind false results if that's not what's happening. So we like to have it where our reps do come in, and we do an audit on a monthly basis called 15 Steps, that again we do with, we'll escort a governor, a patient governor around, or a non-exec director, and they will go and talk to patients about the hospital, and they will ask them about the hospital environment. They will look at the environment as they walk into an area of, what is your impression in the first 15 steps? into this ward, and they will report that back. I've only been doing those for the last 6 months, but every time we've had really good feedback, both from patients and the non-execs and the governors around the environment of the hospital.
Yeah, Sherwood is very welcoming, as some of you may know or may not know it, in Mansfield, Nottinghamshire. It's the 3 towers that stand out the most. They're all lit up. It stands on massive ground, and it's absolutely amazing if you do go. It's very welcoming as you come in, and obviously it's part of the place as well. That is what, with you guys being FM, you will all probably know about the place, inspections and what it entails. So obviously to achieve 99.85%, yes, we do have room for improvement. We need to get a bit more, but that's something we can aim for. We're never going to be 100% because they'll find something. It's a tiny little bit of dust in the corner. But yeah, at the Trust, we work collaboratively together, and it's really important that we have that working partnership, down to the fact that, like Sally said earlier, if we need something, we know we can just call our colleagues and then we'll come and assist for us. Yes, we are a contracted hospital, but that goes out the water. It's patient safety first, and obviously cleanliness and the environment is a key matter.
That was me on Friday morning on my day off, because my email hadn't gone saying, can you move the decant team to Newark for tomorrow morning because they've cleared us 6 beds. But they got on it and we went straight over on those phone calls. So as I say, very responsive team, but it's having that knowledge of who to contact at the right time.
And working in partnership. And
absolutely.
Key, isn't it, is working in that partnership. Yeah.
And obviously the innovations, what we do have at Kingsmill, and obviously Anna works quite closely to us with some of the innovations what we have. I'll just skip that because we've actually talked quite through a little bit of that. So the new innovations that we're moving forwards, the window buddy, so obviously that's going to be used on site at some point to do all the windows, which will then obviously alleviate one of the staff members to do like the touch points again or something else within that area. And we're looking at the robotic vacuum cleaner as well, so that's going to be something that we're going to be coming forward using that. And we have picked up, Anna, on the one before you're at the spill. Yeah, we'll contact you about that.
Definitely.
We need that. So yes, the new innovations, and as Sally said at the beginning, our Trust is one of the key ones to trial any innovations that's out there. We like to be tested, because if it works, we will go with it. Money prevails, obviously. Within every Trust, we're all funding orientated, and if we've not got the funding, then it's very difficult to move forwards. But as a testimony, obviously, the cleaning standards, the slide previously, we've always got the 5-star rating up on every area to show what standards each department, area, clinical space is. Ours always ranges between 4 and 5. If it drops below that, then obviously there's implementation plans and action plans put in place. But obviously Ella, the robot, and obviously the new innovations that's going to be coming forward will hopefully help and keep our scores up. We do try and, anything that's needed with the teams throughout the Trust, we are all there to support one another. But yes, what time are we at? Are we? Got plenty of time.
I've still got.
Go on, Sally.
So I think, as I say, I think it's really important from an infection prevention point of view that everybody works together as much as possible. We can't do it on our own. We can't keep patients safe without our FM services. There's absolutely no way that we could do that. It's an integral part of our organisation. And we have had some challenges recently that we've had to all work together to overcome, and we've done it, and we've maintained that service. We've looked at where we might need to adapt things. Can we look at our lower risk areas and maybe move that today and do that another day while we focus on some of our higher risk areas, because we all have challenges. Nursing has challenges with staffing. That's okay, we work around it. So it's important that we enable and support yourselves in an FM perspective to work around that as well, because why is it acceptable for us? But we then, we can be quite harsh sometimes when our providers don't have that, and it's really key for me that we're able to work together to support and and put that support in and look at where we can adapt things and move things around. It's not a permanent solution, we know that, but it's around, you know, at that time what's happening. Again, I bring it back to COVID. We all saw high levels of sickness throughout COVID, and we did have to work around and change some of the practices that we did. And it's looking at how we keep that, the good things that we've learned from COVID, it's how we keep that and build it into how we move forwards. So we have seen some significant improvements using the new innovations. Not just robotics, there's other innovations that we've brought in within the organisation as well, and it does improve our standards across the trust with support from the Soft FM team. Our C-diff rates, once we implemented our decan and the innovations again, we had 72 cases a year, we dropped to less than 60 in that, which, you know, because it is an environmental organism, it will live in the environment. If many of you may know, it will live in the environment for months if it's not cleaned correctly. So we throw everything at it we can because we don't want our patients to acquire C. diff. It's not a nice infection to get at all. And norovirus, because we employ a lot of the same things through the norovirus seasons. We have been extremely lucky, and again I'm going to touch wood now, over the last few years where our norovirus outbreaks have significantly reduced. I want to caveat that with our new build that we've been talking about has 50% ensuite side rooms, so I do need to put that out there as well because that will have an impact on that. But when we have had our recent outbreak of norovirus on our only cardiac ward, so the one ward you really don't want to close unless you've absolutely got to, we were able to maintain that outbreak. We had to close the ward probably 4 days. For about 4 days, the cleaning team were there. As soon as we'd got a bay empty, they were in there, they cleaned it, they sealed it, so that we were ready to go when we could open it, and we got those beds when we needed them and when we were able and safe to open. And again, by us working as closely together as we do, we don't get as much pressure from the senior trust team to open those beds early, because you know you can be, when can we have that back, when can we have it back, we need it, we've got these patients in ED. They will listen to us because we talk to them together. This is, you know, we're being realistic, this is how long it's going to take us to do this, please give us that time. You know, you'll get a little pushback on, can you do it a couple of hours earlier, but we certainly don't get as much pressure to say, no, you've got to do it now for us. So that's a bonus for us from working together. As we said, we actively support new innovations. I think it's key that we keep moving with the times. We keep looking at ways to better improve our environment. We aren't going to be able to change it for a long time, not now. Now we've got our new one. So it's how do we maintain that for as long as possible, and looking at what's changing, looking at that evidence base, but we can't get that evidence base if nobody's willing to try it and to do those studies. So that's why we are always working together to do that. We're happy to write a paper, we're happy to support and gain that evidence. We've always been striving towards the highest levels of cleanliness. It is a real key thing for us. So part of our Infection Prevention and Control Committee is we ask Kate and her team to come, provide a report every month to say, this is where we are with the cleaning standards. This is if we've dipped, why have we dipped, what support do you need from the trust, what can we do to help. We look at, so we have a RAG-rated cleaning system. So we have red for hydrogen peroxide, we have violet for ultraviolet, amber for our peracetic acid clean, and green for a general discharge clean without infection. We monitor that as well, so we work with the team very closely to see, are we going up on cleans that are requested? Are we performing enough based on the patients that we see coming through the organisation as an infection control team? Do we see enough? Do we need to look at the resource we've got and support there, where we have had recently a team, because they feel it's quicker to get an amber clean than a green, so they'll put an amber clean through because they feel they get a quicker response. which it's not really, and it takes longer. It does take longer. So that's enabled us with that report and that information from our FM services. That's enabled us to go out and educate the clinical teams as to what's right and what's wrong, how we need to work together. On that, I think it's really important. I'm a patient at our hospital. It's my local hospital. I'm a patient, and I will always strive for the standards that I expect. I have on occasion been told they're too high, but I don't apologise for that, because I think that's what we should be. That's what I want for myself and my family, so why should I drop that? And that's something that as a team we all understand together, and we all work to those same standards, I think, from our perspective.